This video will review the 5 ethical principles in detail. The first 2 principles are beneficence, from the Latin meaning do good, and non-maleficence, from the Latin meaning do not do bad, or do no harm. Are they different, or are they just 2 sides of the same coin? Well, the ADA lists them separately, so I will do the same. Beneficence involves promoting good. This could include proper diagnosis and proper treatment plan presentation. Violations could include failure to diagnose or failure to treat, not promoting the best treatment, or patient abandonment. Non-maleficence involves not hurting someone. This includes appropriate treatment and execution of that treatment. Violations could include unnecessary care or aggressive care, incompetent treatment, and not referring when indicated. The next principle is autonomy, respect for others' choices. From the Greek words auto, meaning one's own, and nomos, meaning rule, principle, or law, autonomy means allowing others to make their own choices. Studies have shown that capable people benefit from making their own health decisions, and that making their own decisions gives patients satisfaction. This principle is thought to be the most important of the 5 principles by far. Here is probably the most controversial question in all of medical ethics. Is it ever appropriate to interfere with a patient's autonomy? This woman in her 40s wants all her maxillary teeth extracted. There's nothing wrong with her teeth or the supporting structures. We will talk in class this week about Answering yes to the question, is it ever appropriate to interfere with a patient's autonomy, is called paternalism, interfering with the autonomy of a patient who is about to harm themselves, like the woman in the previous scenario. Whether or not paternalism is acceptable is debated among experts in ethics. Should we refuse to let patients make bad healthcare decisions, or do we let them make those bad healthcare decisions? That is a huge question, and we will start talking about it this week. The next principle is veracity. Coming from the Latin word meaning truth, it means honesty. There are 2 kinds of veracity violations: dishonesty, also known as a lie, and willfully omitting something. Not telling the whole truth is really also a lie. Making a decision depends on knowing the truth. Both parties have the right to choose, both the patient and the dentist, and both parties must tell the truth. The dentist has to give the patient the whole truth, and the patient has to tell the dentist everything. So, while we are talking about honesty, is it ever advisable to admit you made a mistake or apologize to a patient? Like, what if you treat the wrong tooth? You saw this in a previous video. Choosing to behave ethically can involve risk, some penalties, or some sacrifice. Telling the patient the truth is the right thing to do. The last principle is justice or fairness, which involves treating all patients in the same way without any bias. This would include emergency patients, making sure that they are treated in a timely fashion as you would for all of your patients, people with disabilities, and people who have access to care issues, so treating Medicaid patients the same as you would the rest of your patients. And finally, charity. We all have to look out for those who have no way to pay us. Some people add a sixth principle, fidelity. This mostly relates to keeping the patient's medical information confidential, so we will not be discussing fidelity as an ethical principle. So those are the 5 principles, and we will explore them further with cases in class this week.